I know you made a point of clarifying a few things on back pain specifically in contention of some things that have been said on a podcast of Andrew Huberman. I mean, no way meaning to start he said, she said, but there were a few points that you really did want to highlight as misleading or potentially pointing people in the wrong direction in terms of what the solutions to their problems might be. Back pain is a complex and largely individual issue for the most part, I would imagine. But again, verbatim, I'm just going to read your own words back to you just so we've set the scene. But back pain is not caused by weakness. Back pain is not caused by posture. Back pain is complex and not so simple. And you reference this as potentially harmful to many listeners for the following reasons.
Yeah, and that's where I would follow up with, we were talking about the basics in most cases. And so then when we start to look at why people have pain, it's very complicated. Like right now, I have a coach at my gym who is dealing with this lateral knee pain. If we go and we test the guy, he is a unit, incredibly strong. He can, squat double body weight, no problem. He has the ability to jump super high distances, windmill dunks, no problem. And so are you going to come and say that the reason he has knee pain is because he's weak? That doesn't really justify. And the same thing can be the case for back pain. There's so many instances of power lifters, extremely dedicated and well-decorated strongmen and weightlifters who have back pain. And I would never say that they're weak. They're clearly absolutely freak human beings and very strong, but something is the reason for their pain. And the same thing goes for the average individual. If your mom has back pain, is it because she's weak? What is the activity that's so stressfully demanding on her system that she is too frail to be able to do it? I don't know your mom, but probably not the case. Most people are not maxing out their strength requirements on their back on a day-to-day basis. The funny story is that we are, we literally, I don't know about you, but I max out my strength.
I'm going to in about an hour. Yeah, that's for sure.
And I don't have regular back pain. Sure, it's sore sometimes because I did literally max it out, but otherwise I'm fine. And that's where the divide comes, is that we get these narratives that come because when you do have someone train, so doing the active resistance training, which does tend to transfer over to strength changes, we see reductions in pain. And so then someone takes that and says, okay, if X, then Y equals Z. And it's a dangerous path of going down a post hoc fallacy where you think that that's what is the reason for it. But it's actually that it's a lot deeper, because there's multiple things that occur when we do this active resistance training. The individual starts to empower themselves. They start to challenge beliefs around their frailty and their weakness, and starting to gain more confidence in the usage of their back. They explore ranges of motion. They cause metabolic changes. All of these things occur at the same time. And so, is pain due to weakness? Probably not. Are there instances where it might be the case? Sure. In contrast, do most people benefit from lifting, getting stronger? Absolutely. Definitely. Even if it's maybe not specifically, we'll call it current back pain, future back pain might benefit from it. We see this right now. There's a fantastic group of researchers in Australia where they're doing this study called the Lift More trials, where they're essentially taking older individuals, usually the cutoff is around 55, and then having them smash squats, deadlifts, overhead press, and I think jumping pull-ups. And they are they're hitting them hard. They're doing 3x5 at near failure. And they are making improvements in their bone mineral density, their muscle mass, and seeing positive changes in their health factors, reductions in fractures, all super desirable things that pay off in the long term for back health. Because the back pain that many of us may deal with at this current time could be related to one thing, whereas in older years it might be related to other factors, like when you have a fall and you fracture something.